Advanced planning with Martha is the most complex of the three individuals we are following. She does not have a family or a trusted friend available to support her in this process or to serve as her healthcare representative. Martha is at risk for abuse through self-neglect or financial exploitation from others. At some point, she will not be able to take care of herself. She may not be able to take medications as prescribed, be able to prepare meals, or be safe in her home. She may become the target for financial exploitation. Recall, she was willing to give the options counselor information about her bank account. The challenge for the options counselor or adult protective services provider or meals programs, home care workers, and others who comprise her support system is to continually balance what is important to her with what is important for her. If Martha is unable to participate in this process and is making decisions that put her or the lives and well-being of others in danger, a guardianship may be required. Seeking guardianship should be considered an alternative of last resort. Assigning a guardian requires a court proceeding, and Martha can object and make her case in court. If Martha is judged to be incapacitated and unable to make decisions, the court may appoint a guardian. The number of guardians, however, is limited, and they are not easily available in many areas around the state. Even if a guardianship is granted, the guardian will not have the ability to make all decisions, just in those areas where the person is judged not to have capacity. If Martha has fewer than $10,000 in assets, then the guardian is able to manage these funds. If her assets are greater than $10,000, the options counselor would need to consider a conservator. It may be that Martha is found to be capable of self-care, but does not have the capacity to manage her finances. In this case, the court would appoint a conservator, that is, a person to manage her finances. The conservator must answer to the judge annually, and the conservator can make financial decisions only, and not decisions related to physical care or personal decisions. In some situations, one person may serve as both guardian and conservator for an individual. Before a case manager or options counselor would consider a guardianship or conservatorship, they would attempt other approaches to support Martha while balancing what is important to her with what is important for her. These might include working with the bank to set up direct bill payment, direct deposit, and monitoring her bank account. As we've seen in Oregon, the banking system has been incredibly helpful in reducing and identifying financial abuse. Continuing to develop a relationship with a person with dementia is also vitally important. Although Martha is likely unable to remember the options counselor or case manager when she does connect them to pleasant, supportive individuals. Because of that relationship, they can talk to Martha about what is important to her and what she needs to live the way she wants. This could include helping her to move to adult foster care or some other setting so that she continues to do the things that she enjoys. Toward the end of life, verbal abilities of the person with dementia have been lost. In the final stages, several physiological changes occur that make it difficult for the person to move and require that they have help for all personal care. Muscles become contracted. Eating problems become more common as the person loses the ability to swallow. Pneumonia occurs frequently. Palliative and hospice care is often the preferred approach for those in these final stages. More aggressive treatment typically results in distressing symptoms such as difficulty breathing, pain, and agitation. Palliative and hospice care focus on comfort and symptom control. Hospice services can be available in all care settings, including the person's home, nursing homes, assisted living, and adult care homes. Sometimes families are reluctant to ask about hospice care because the trajectory of dying in the last months and years is very unpredictable. Families may worry about the requirement that the person be at least in the last 6 months of their life. Encourage families to talk with healthcare providers and explore these issues with them. Making person-centered end-of-life decisions at the end of life without advanced planning or prior discussion with the person with dementia can be extremely difficult. If healthcare representatives have had any kind of prior conversations or know the person well, they may be able to make decisions based upon what that person would want and not based on their own preferences. If this is unknown, then decisions that would be in the person's best interests are appropriate. Ethics committees in hospitals and in some nursing homes can be helpful if there are disagreements about the best course of action or what the appropriate decisions are. An important end-of-life planning document is the POST, and Joanne Lynn referred to this. This stands for Physician's Orders for Life-Sustaining Treatment. The POST is a standing medical order that directs other medical professionals either to provide or deny life-sustaining treatments based on the person's wishes. It's used for people with a serious health condition. It follows the patient or the person with dementia's wishes and treatment intentions regarding things like resuscitation, medical conditions, use of antibiotics, and artificially administered fluids and nutrition. A healthcare representative may discuss the POST form with a physician or nurse practitioner if the person with dementia has not done so early in the disease process.